So I'm Kirk Sanford. I'm the founder of Longevity Medical Institute here in San José del Cabo. We've built here a world-class facility that is regenerative medicine and anti-aging. The regenerative medicine side of our business is a focus on patients' cellular health, so the internal part of how they think about their health and wellness, being proactive through treating various conditions. The other part of what we do is what we call the anti-aging division. I want to talk about that today. So I want to introduce you to Dr. Luis Romero. We're gonna talk a little bit about what he did today as one of the procedures. But the anti-aging division encompasses sort of a broader category, which is focusing on how you look, right? So internal is regenerative medicine, external is anti-aging, and anti-aging ranges from doing things like the dermal fillers to the Botoxes to lasers. So we have an IPL, YAG, CO2 type lasers. But when you have certain patients that get identified that they're not a fit for those categories where you have to do a bit more of an invasive procedure, we have Dr. Romero to do that. So he is a plastic surgeon. He's done over 6,000 surgeries. And they go through a broad range of different categories. I'll let him talk a little bit about that. Today we did a Mentoplasty, which is a chin implant for a 20-year-old patient, which you'll see that video. For patient confidentiality, obviously we're not going to disclose who she is or the details that are identifiable. But you'll be able to see firsthand some of Dr. Romero's amazing work, and I call it magic. He absolutely loves what he does. So this is Dr. Luis Romero, plastic surgeon here at LMI.
My name is Luis Alfredo Romero. I'm a facial plastic surgeon and an ENT, head and neck surgeon. So today we perform a mentoplasty, meaning that we work on the jawline and introducing a chin implant. This is the safest way to perform it by local anesthesia and mild sedation. It won't take more than 30 minutes and the patient is all ready to go home. So the safeness here about the facial plastic surgery lay around the deep sedation instead of using general under anesthesia. We can perform several facial surgeries at once, and we can go up from the forehead lift or the full facial lift or the deep plane face lift, even rhinoplasties, eyelid surgeries, buccal fat removal, double chin liposuction, or the revision rhinoplasty and ears otoplasty.
So, one of the things that excited us, I've seen Dr. Romero's work prior to coming here, and his patients look amazing. They don't look like somebody else. They look like themselves and a better version of themselves. So I'm really excited to have Dr. Romero here. I think we're gonna have a lot of patients very excited, especially if you look at the demographic of our patients, which are sort of your 60 plus, they're much more candidates beyond now just perhaps lasers and dermal fillers and Botox. I mean, those might still go in hand in hand as an adjunct, but they're really now becoming a category when you talk about facelifts and some of the other things he just mentioned to really serve that patient base. Here in San Jose, which is amazing, we have an amazing pre-op room, recovery. We also have condos here on site that allows patients that complete privacy and luxury. They're beautiful 2-bedroom condos where they can recover. A nurse can stay with them depending on the procedure. A lot of procedures that Dr. Romero does are actually fairly quick and patients recover very fast, but maybe some of the more advanced stuff may require a patient to stay.
Yeah, exactly. For example, patients are looking for a full facelift, won't need more than a full week staying, so we are having here enough space on the facilities to their recovery.
Great. Thank you, doctor.
I've been honored to be invited in this huge project, and once we already know everything about how these longevity strategies reyouth our patient from the inside, and well, now I'm invited to make all the reyouthful surgery from the outside, so I think that it's a perfect match.
Thank you.